Welcome to the Gym Shorts podcast series. I am your host, Kathy Smith. Hello, and welcome to the Gym Shorts podcast. Today, we're very lucky to be speaking with the president of Children's Minnesota, Dr. Marc Gorelick. Dr. Gorelick joined Children's in March of 2017. He previously served as executive vice president and COO of Children's Hospital of Wisconsin in Milwaukee. A pediatric emergency medicine physician by training, his prior experience includes faculty positions at Medical College of Wisconsin and University of Pennsylvania, clinical leadership roles at Children's Hospital of Philadelphia, A.I. DuPont Hospital for Children, and Children's Hospital of Wisconsin. Thank you so much for joining us today, Marc.
Thank you. Thanks for having me, Kathy.
We're here today because we care about kids. And like you've said, we're here to stand up for them, to protect those who can't stand up for and protect themselves. We're here to hear your story, Dr. Orlick, and to talk about kids and gun violence and what we need to do now. Please tell us a little bit about your inspiration to write the book, Saving Our Kids, an ER Doc's Common Sense Solution to the Gun Crisis.
Kathy, this is something that's actually been important to me really almost since the beginning of my career. I've actually been writing in some form or another about this since I was a pediatric resident. And it's really about the experience that I've had as a pediatrician, as a pediatric emergency physician, taking care of kids who have been victims of gun violence. Um, in many cases, those are kids who've been shot. In many cases, they're kids who've been otherwise affected, having family members, for example, who've been shot. And um, back in 1988, I wrote a letter to the editor of the Washington Post. And at the time, I was decrying the fact that guns were the second leading cause of death in kids. And here we are in 2024, and it's now the leading cause of death in kids, gun injury. And so it's really my experience as a care provider that has led me to think, how do we stop this? How do we prevent this?
Yeah, I mean, it's traumatic and it's sad. And I'm just grateful that there are people like you out here that care enough to push that envelope. Dr. Gorlick, I liked your point that it's not just about the gun, but a combination of guns, people, and the environment they inhabit that leads to gun violence. Can you tell me more about that?
Yeah. So back in 2022, we first learned data lags a little bit that by 2020, guns had become or gun injury had become the leading cause of death in kids. And a lot of people stood up and took notice at that. Many of us found that really appalling, and we started talking about it as a public health crisis. And and it is a public health crisis. The Surgeon General recently declared it a public health crisis. But calling something a public health crisis doesn't just mean it's a big problem. It is a big problem, but it also public health issues have a very specific framework for thinking about them if you want to address them appropriately. And that is to always think of public health issues as being multifactorial. So the public health model is a sort of a three-legged stool that talks about the cause, the agent that causes the injury or illness, in this case, the bullet and the gun, the individual factors that influence whether or not a person gets injured, and then the social or environmental factors that influence whether or not a person is injured. And a public health approach requires us to think about all three of those and the complex interplays between them. You can't just talk about one aspect of it. You can't just talk about the gun. You can't just talk about individual responsibility. You can't just talk about the media, for example. We really need to think about all of those if we're going to have an effective approach to reducing the burden of this on kids and families and society.
Dr. Garlick, you mentioned you often hear people say they're scared to bring up this issue of gun safety. They don't know what to say. They're afraid it's going to be too controversial or too polarizing. Here we are, weeks away from the next presidential election, and I admit I'm nervous too. I don't want this information to be political, but I also agree with you that this issue rises above the politics. What do you say so people don't politicize this conversation? How do you rise above that?
I try to call attention to a couple of things. First is just as a public health issue is multifactorial, as I mentioned, the approach to it has to be multifaceted. And approaches to those three factors in gun injury
Mm-hmm.
uh, includes individual action, community action, and policies. So, in some sense, this is a political issue in the sense that we need policies if we're going to affect the the burden of this on kids and society. Where we need to be careful is political doesn't have to be partisan, and and so I try to straddle that line between a partisan approach to this, which is a polarized approach that focuses not on the issues itself, but on the potentially the implications of the issues, and really think about the policies that have been demonstrated to reduce gun injury in kids and adults. So that's one thing, is trying to stay on the right side of that line between being partisan and being political. The other is this is not a unique problem in that regard. We've had many public health crises in this country's history that have at one point or another been a partisan or even a moralistic issue, and we've made progress on those. Alcohol abuse for decades was seen as a moral failing. And talk about a partisan issue. There was literally a political party founded on the issue of prohibition. We no longer see it that way. We don't talk about this in moral terms. We talk about it in medical terms. Alcoholism is a disease, and we have a public health approach to it that includes things about the product, things about the individual, things about society. More recently, HIV/AIDS was seen as a very partisan, polarizing issue that we have now moved the needle on that discussion, and we now talk about it in health and medical terms. And so I do have hope that we can do the same thing with gun violence, with gun injury, to move from it being a moralizing issue, where on the one hand people talk about gun nuts, and on the other hand people talking about zealots who want to take away gun rights, and actually focus on the issue of it's actually about the injury. It's about kids getting injured, in this case by a gun or a bullet fired from a gun. And can we talk about that rather than the partisan and moralistic aspects of it?
In your book, you write that this should be considered a public health crisis. How did we come to this place in the world?
Honestly, it's a good news, bad news combination. The positive part of it is part of the reason that guns are now the leading cause of death in kids is because other causes of death have been reduced. And in particular, motor vehicle crashes, which for a long time were by far the leading cause of death in kids. And those have come down dramatically. Here's another example where, in the 60s and 70s, this was a very polarizing partisan issue. People didn't, don't tell me about seatbelts, don't tell car makers what to do.
Yeah.
And really starting in the 90s, we started to address it as a public health issue, and we took a multifaceted, multifactorial approach. And as a result, car crashes have come down significantly. At the same time, gun injury has gone up. And I think it's because of the failure to address gun injury in the same way that we addressed motor vehicle injury. And I think we have a lot to learn from that. It's very similar principles. Both of them are public health issues harming children. And in the one case, we took that public health approach and we dramatically reduced the burden of injury. And in the other, we have so far failed to do so.
Mark, kids and gun violence covers such a big landscape, and with nearly 33,000 children ages 1 through 19 killed from firearm injuries in 2012 through 2021, it almost seems too overwhelming to attempt to start. Is your approach to solve this crisis the same, regardless of what kind of gunshot injury you're dealing with, whether it's unintentional or violence related or self-harm?
Yeah, so first, I think you raise a good point, which is firearm injury encompasses all of those.
Right.
If we look at children specifically, where the time period you pointed out, we've had about 33,000 gun fatalities. For every fatal gun injury, there's about 5 or 6 non-fatal injuries, which have their own physical harms, emotional harms, and of course monetary costs associated with them. So it's a huge problem. Most recent information from 2022 is that we're up to about 4,700 children dying from gun injury each year. of those, about half, a little bit more than half, are uh, interpersonal injuries, someone shooting someone else intentionally. Um, Somewhere about a third or a little bit more are self-inflicted suicide, and then a small percentage are unintentional. Someone finds a gun, they pick it up, they shoot themselves, they shoot somebody else um, unintentionally. In some ways, the approach is the same, right? The same principles of thinking about the different factors and the different potential interventions and thinking about it holistically in that way. There are interventions that have been shown to potentially prevent one type of gun injury, but not another type of gun injury. So, for example, safe storage practices where guns are stored unlocked, or I'm sorry, locked, unloaded, and with the ammunition kept separately. Um, those have been found to have a dramatic effect on unintentional injury and on suicide, much less so on intentional interpersonal injury.
Okay.
Um, Background checks an effect on both types. So I think we do need to follow the same public health principles of thinking about this as a health problem and what are the factors, and then really understanding and doing more research to understand which approaches actually help with the different types of injuries so that we can effectively implement them.
What about local communities? You share that young people of color are more impacted by gun violence than their white counterparts. And you share the six root causes of gun violence in communities of color. According to Johns Hopkins Center for Gun Violence Solutions, are income inequity or inequality, poverty, underfunded public housing, under-resourced public services, underperforming schools, lack of opportunity and perceptions of hopelessness, and easy access to firearms by high-risk people. To me alone, it seems like it's cyclical and one leads to the other, one becomes the cause, one becomes the many underperforming schools are in low socioeconomic neighborhoods, and it just kind of seems to go along with all of it, which generates under-resourced public services, which generates lack of opportunity. I know you can't solve every problem and your focus is on health, but is there something that can be a cog in this wheel? Is there something that can say, hey, we got to do this and therefore the results will change or the outcomes will change?
Like a lot of public health issues, when we talk about the three factors, the social or environmental factors are often the most intractable. Um, there are some that may be very specific. So, for example, there is some evidence that the ubiquity of guns in media, for example, um, uh, sets us up for a higher rate of gun injury. But many of these factors that you talked about, poverty, lack of resources, and so on, those underlie a lot of public health issues. So anything that can be done to improve those underlying risk factors will undoubtedly ameliorate um, gun injury in those communities, as well as a host of other benefits. But as you pointed out, those are fairly big, intractable problems. And I think in the meantime, as is often the case, we also need to pay attention to what are some of the more immediate, tangible things that we can do to address this particular problem. And you're right. It does disproportionately, in fact, impact communities of color. So Black youth and American Indian Native youth are more likely to be affected by gun violence. But I do think it's important to recognize this does affect every single community. And that's one of the things that sometimes gets in the way of solutions is people think that it's just those people,
Yeah, not in my
however you
backyard.
define that. And in fact, every community in this country is affected. Every racial, ethnic, socioeconomic group is affected. Um, there are kids killed by guns in every single congressional district in the United States, and so while certainly those social factors that you mentioned are an important underlying risk, and we need to address them, we also need to recognize that this is a universal problem, and there are some more targeted specific solutions that we can try to more readily implement in the short term, I think.
So, Dr. Gorelick, as a former teacher on the north side of Minneapolis, some of my students, and particularly boys in the fourth through sixth grades, have been invited and initiated into gangs, and all they really had to do was carry guns and drugs. One of the boys I taught told me he would do it because he would get some new Nikes and some new clothes and be a part of a group. And the gang leaders tell the boys that the worst that could happen is they're going to go to juvie for 6 months and they'll be back out on the street because they're so young. It breaks my heart as a special ed teacher in that community to see these kids being targeted and being drawn in, and they're fourth grade, they're sixth grade. What were you doing when you're a fourth grader, right? What I was playing outside on my bike all day. It's heartbreaking to me.
Yeah, it is heartbreaking. And I think I certainly don't have the answer, but I think it underscores the need to, again, think about this from a public health perspective. I think for some people, they see gun injury as a gun problem and therefore a law enforcement problem.
Mhm.
And certainly, thinking about the public health model, it needs to be a multifaceted approach. There do need to be policies that influence this, but that alone isn't going to do it. And so I do think that, the example that you pointed out is exactly why we need to think about both not only the individual factors, but the social factors, and really take an approach that addresses all of them. So yes, law enforcement is a part of the answer,
Yeah.
and community-based interventions are a part of the answer, and school-based interventions are a part of the answer, and we need to think about all of them, as opposed to simply thinking about it as uh, to the point you made, um, uh, ratcheting up the punishment level so that people will um, not use guns, because that's not working in this case. It doesn't work down at that
Not
age group,
working.
but there are things that can be done, and we need to think about all of those as part of the solution.
Mark, I really just want to say thank you so much for your immense love of children and your dedication to your role as a pediatric ER doc. You mentioned every time you cared for a gunshot victim, you kept it together for their family during the time that you were helping them, but that afterwards you cried every time, every single time. I can't imagine the level of grief that you have carried over your career. Do you know how many children you have personally seen in the ER with gunshot wounds? And is this fight not only extremely important, but a way for you to grieve? I promise to help those that have lost their lives.
Yeah. Yeah, thank you for the question. I mean, I don't know how many. I mean, I practiced for 25 years. What I do know is that I know that a lot of the patients that I took care of were affected in one way or another by gun violence, whether or not that's what they came into the emergency department for. Um, and and yes, in some ways, maybe this is a way to grieve, but more importantly, it's a way to try to keep others from having to grieve. Um, it really is about trying to make a difference. And I know people think this is important. I mean, nobody
Right,
thinks it's okay for
right.
kids to be shot. Nobody does. Nobody, gun owners, non-gun owners, Republicans, Democrats, Independent, nobody thinks it's okay for kids to be shot.
Yeah.
So I think that's something we can all agree on. I think we can all agree that this is a horrific thing that is truly heartbreaking. I think everybody's heart is broken um, when they hear about these things. And how do we build on that brokenheartedness to say, how do we start to make a difference?
We're aware that there is so much information about teens and mental health in social media. Jonathan Haidt, author of The Anxious Generation, as well as many other social psychologists, talk about the addictive content that smartphones deliver to kids, displacing physical play and in person socializing, and the rewiring of kids starting back in maybe 2010. What are your thoughts on the connection between smartphones, mental health, and kids and guns? Is there any research on that, or?
I don't know that there's specific research on, say, for example, cell phones and gun injury. I
Mhm.
do think, though, again, thinking about there are individual factors that influence whether or not somebody will use a gun to either harm themselves or somebody else.
Mhm.
And we think about mental health very broadly.
Um,
And but I do think, for a variety of reasons, and some have included things like social isolation and over reliance on technology as a contributing factor to the very marked rise that we've seen over the last more than a decade in depression in children and youth. That is certainly a risk factor. Um, and so I do think that, again, if we think about the complex interplay of factors, some of those trends that we've seen that are affecting the mental health and well-being of children and youth are playing a role in what we're seeing in both uh, interpersonal injury and self-inflicted injury.
what role do groups like Moms Demand Action play in this kind of a space as far as helping make changes? Do you know anything about them?
Yeah, I do. And I think, uh, again, we do part of the armamentarium for addressing public health issue like gun injury is policies. And Moms Demand Action is an effective group at advocating for policies that have been demonstrated to reduce injury. One particular role that I think they can play, and frankly, a role that um, health professionals like myself can play, is the ability to share not just statistics but stories. Um, and uh, the fact that there are on average two children shot every hour in the United States um,
Wow.
is uh, is an appalling statistic. But it's an abstraction. But groups like Moms Demand Action, uh, healthcare professionals like myself and my colleagues, we can share stories, and stories can often be more compelling than statistics in motivating others to step up and do what's needed to make a difference.
The stories that come to mind when you're thinking like that, or anything that you would, I mean, over
Well, I've
your
shared some of
kids?
them in the book. Individual children that I've seen who've been shot, and what that's like. Uh, you know, what it's like to literally watch somebody bleed to death from a gunshot wound is something that nobody wants to ever have anybody have to see. Um, but to be able to describe that to somebody is it can be compelling.
Mark, we could talk for hours about this topic, and it's time for action. You're right. For many people, it's not a motivation problem. It's a where do we go from here problem. So, with all of your experience and knowledge, where do we go from here?
One of the first things, and this gets back to an earlier question you had, is we do need to talk about it. People shy away from it. People shy away from, and we look, as humans, we shy away from a lot of things, right?
Yeah.
Um,
Lots.
I think, for a long time we didn't want to talk about, and many individuals still don't want to talk about mental health issues, right? Because there's a stigma attached to mental health. There's a stigma attached to substance abuse. There's a different kind of stigma attached to gun violence, which is that it's going to be seen as polarizing. It's going to be seen as partisan, and we need to actually have the conversation. We need to talk about the fact that it's the leading cause of death in kids in the United States. Nobody thinks that's okay. Not a single person thinks that's okay. Um, but if we don't actually raise that issue, we will never get to the point of being able to talk about, so what do we do about it? So I think normalizing the conversation um, and starting to really talk about it as a health problem, right? This is, um, you know, guns themselves are not the problem. I'm always delighted when my cousin, who is a hunter, gives me venison. Like, that's awesome. I readily take advantage of that. We're talking about injuries. We're talking about injuries, and that's, it's kids being injured, it's kids being harmed and killed. And so talking about it as a health problem, I think is a starting point, and being able to talk about it with friends and neighbors and elected officials.
The one last question that I always ask our guests. I'm a huge advocate for reading literacy as well. And so I love to ask everybody, um, what was your favorite children's book, or what is your favorite children's book and why?
Oh gosh, well, there's so many of them, Kathy. So I'm going to actually cheat and pick two.
Okay.
one for younger kids and one for older kids.
Okay,
But
good.
for younger kids, one of my favorite books to read with my kids was If You Give a Moose a Muffin. And the reason I like it is it's just so clever, it's engaging, and I think it teaches an important life lesson about thinking about consequences. Um, and then for the older kids, it's probably a lot of people would cite this, but I have to say the Harry Potter books, and because I think it encourages both reading together, which I think is so important, and um, talking about what happens in those books, which is so much about the issues that kids and youth are facing. And it's such a great stimulant for those conversations. I know I had with my kids when they were young. So those are among my many favorites.
Oh, I love
I
it.
couldn't
Yeah.
agree more. Reading to my kids was always a highlight of the day.
Thank you so much for sharing your passion and your thoughts on changing this landscape. If there's any last thing that you want to share, please feel free to tell us more.
If you care about kids, which I do both as a parent and as a pediatrician, um, then it's impossible not to care about the thing that is currently the leading threat to their life, and that is gun injury. And so I would urge any of your listeners who care about kids, and I assume that they all do,
Yeah.
to think about how they might start talking about this and raising awareness and advocating for a comprehensive approach, not banning guns, but how do we address all of the factors that contribute to what this has become and start to make a difference?
I just want to say again, this heartfelt thanks for the care and concern you have for kids. It's very evident. And I hope that you are the one that starts the change that we need. So thank you so much, Dr. Gorelick.
Well, thank you. I appreciate it. And thank you. I appreciate it. Thank you for the opportunity to be on the podcast.
Yes, yes, we're very excited to have you.